Hello, everyone. Just going to wait a few minutes for everyone to log in. I'm going to try to start to post more topics about health more frequently, maybe a few times a month. And I know it's getting late, so we can get started. I am Dr. Nicole Martin, your double board certified family medicine and preventive medicine physician. I help busy professionals use preventive and integrative therapies to not only improve the symptoms of many illnesses, but to cure some illnesses and truly save lives. Through my programs, books, and seminars, you will get healthy and stay healthy. So, today's topic is diabetes. November is National Diabetes Awareness Month. So, what we'll do is we'll talk about diabetes, and I'll even give you tips on preventive and integrative therapies that may actually help improve your current condition. But I just want you to know that this is for educational purposes only. So, this is not official medical advice. So, please do not stop taking any medications or therapies prescribed by your doctor. Talk to your doctor before making any changes to your current healthcare regimen. So you may ask me, what is diabetes? I know it's a term that's, pretty common here in the U.S. It's a medical term and a medical condition that's very common. So diabetes means that when you have diabetes, your blood sugar levels, or we call them blood glucose levels, in your blood are too high. So your body depends on glucose for energy. So when you eat, most of the food turns into glucose. Your blood carries the glucose to other parts of your body, but when you have diabetes, your body has trouble turning glucose into energy. So instead of being used by your body, the glucose kind of builds up in your blood and your body is starved for energy. So this can actually damage the body. Diabetes is a chronic long-term condition. So the basics of diabetes, this is what I really want you all to know, and this is kind of what I stress to my patients a lot. Diabetes is a leading cause of disability and death in the US. It is. But it's also very preventable for the most part. We'll talk about the different types of diabetes in a second, but diabetes, it's so critical to know about diabetes because diabetes increases the risk of serious health problems like heart disease, blindness, nerve damage, which can lead to having a toe, foot, or leg removed, kidney failure, stroke. Um, so there are three types of diabetes that are out there. There's type 1 diabetes, type 2 diabetes, and gestational diabetes. So type 1 diabetes is caused by a problem with the immune system. So the immune system is your own internal system that helps fight infection. Right now, there's no way to prevent type 1 diabetes that we know of. Gestational diabetes is a type of diabetes that some women develop during pregnancy. So, gestational diabetes increases the risk of health problems for you and your baby. For example, gestational diabetes can make it more likely that you'll develop type 2 diabetes after pregnancy. So, you have to be really aware of that and take care of yourself. So type 2 diabetes, and this is what we'll focus on a lot because this is the most common form of diabetes. Type 2 diabetes is very prevalent in the US. They say 1 in 3 people may have diabetes and not even know it. So you are more likely to get type 2 diabetes if you are overweight and inactive or if you have prediabetes. So having prediabetes means that your blood glucose levels are higher than normal, but not high enough for you to be diagnosed with type 2 diabetes. So you may ask me, Dr. Martin, what are some of the symptoms of type 2 diabetes? How do I know I have this? Well, some people may never notice any symptoms. Other symptoms of type 2 diabetes can include being very thirsty or hungry, feeling tired for no reason. Um, urinating or going to the bathroom more than usual, losing weight for no reason, having cuts or bruises that are slow to heal, even having trouble seeing, more like blurry vision, losing feeling, or having tingling in your hands or feet. It's very, very common symptom. Because symptoms of type 2 diabetes can be so hard to spot, it's important to talk to your doctor about your risk for type 2 diabetes. So if you notice any of those symptoms above, ask your doctor about getting tested. And even if you don't have any symptoms, still talk to your doctor. But there's good news. It's not all grim and dim. The good news is that you can do a lot to prevent or delay getting type 2 diabetes, including watching your weight, eating healthy, staying active. Um, but a lot of people may want to know, well, am I at risk for getting type 2 diabetes? How likely am I to get diabetes? So, some of the risk factors include, and this is what I want everybody to pay attention to. If you're over the age of 40, if you're overweight or obese, if you have a parent or sibling with diabetes, if you're African American, Hispanic or Latino, Native American, Alaskan Native, Asian American, and Pacific Islander, if you've had gestational diabetes or you even given birth to a baby who weighed more than 9 pounds, if you have PCOS or polycystic ovarian syndrome, this is when a woman's body produces more male hormones than normal. If you've had high blood pressure or high LDL, that's your bad cholesterol. If you're physically active less than 3 times a week, or even if you have prediabetes. So you all may want ask me, so what is prediabetes? It's also a very common condition, but this is one of the reasons why I kind of stress to my patients that you must be tested for diabetes, especially if you have those risk factors, because the test for diabetes can also tell us if you have prediabetes. So if you have prediabetes, the glucose levels in your blood are usually higher than normal, but not high enough to mean you have type 2 diabetes. So prediabetes increases your risk of developing type 2 diabetes and other serious health problems like heart disease or stroke. But the good news about prediabetes is that healthy changes like losing weight, getting enough physical activity, and uh, eating healthy foods. I like to stress that my patients eat um, whole foods, unprocessed foods. If you can get a plant based diet, that will be awesome for your health, for your overall health. Um, so that can all delay or prevent you from getting type 2 diabetes. But you can always take action. It's never too late. But I do want you to talk to your doctor about your risk for getting type 2 diabetes. You need to find out if you need to get tested. But you know what? I want to stress this again. You are at risk for type 2 diabetes. If you're over the age of 40, if you're overweight, you need to get tested. You can talk to your doctor, and your doctor can tell you how often you need to get tested. So, your doctor may also recommend you get tested if you're younger than age 40 and at risk for other health reasons. You can still be overweight and obese under the age of 40. You still may need to get tested. Um, you may have high blood pressure. That's a reason to get tested, or you even have a family member with type 2 diabetes. But keep in mind that the test for diabetes can also show if you have prediabetes. So, what about cost? Um, a lot of people may ask that, but fortunately, under the Affordable Care Act, insurance plans must cover diabetes screening for adults with high blood pressure, diet counseling for adults at higher risk for chronic diseases. And depending on your insurance plan, you may be able to get these services at no cost to you, but they usually require you to have some type of risk factor. But make sure you talk to your doctor, and you can also check with your insurance provider just to find out what's included in your plan. Um, One major factor in preventing diabetes or decreasing the symptoms, or your total condition of diabetes, is by eating healthy. I always like to tell my patients, um, the key to your health is diet and physical activity. But believe it or not, you know, I guess about, not even I guess, I know this, 60 to 70% of your health depends on your diet. 60 to 70% of your health depends on your diet. So, eating healthy can help you control your weight, and help prevent or delay type 2 diabetes. So, if you have any type of diabetes, remember we talked about type 1, type 2, gestational diabetes, eating healthy can also help manage your condition. I always stress the importance of eating a whole foods, plant based diet, avoid processed foods and anything in a package. So choose foods that are low in saturated fats, added sugars, and salt, and get active. So getting active can lower your risk. It can also help manage any type of diabetes that you may have. So aim for 150 minutes. We just like to say 2 hours and 30 minutes a week of moderate aerobic activity like walking fast or biking. You have to make sure you get that heart rate up. So you can talk to your doctor, and you all can go over some activities, and you all can choose the best activities for you. Um, it's also important to watch your weight. This is very important. And sometimes I try to stress to my patients, we may not want to look at weight right now. We just want you to um, get healthy, get healthy and stay healthy. And when you get healthy, sometimes the weight will just fall off without even trying. So if you're at risk, losing weight by eating healthy and getting active can help lower your risk for type 2 diabetes. But to lose weight, you need to burn more calories than you eat, and you need to eat healthy calories, not just the empty calories, the healthy calories that can be found in fruits and vegetables. You can use and I recommend that you use a notebook, journal, or smartphone to keep a record of your weight, all the meals and snacks you eat each day, the number of calories and grams of fat in your food. This is going to train you to learn, what goes in your foods. What are you eating? Everybody needs to know what they're eating. So this is a good way to train you, so you can be more aware of what you're putting in your body. Also keep a record of how many minutes of physical activity you do each day. Your weight, record your weight, and each time you weigh yourself, I know a lot of people don't like to get on that scale, but you got to do it. You have to take control of your life. You have to take control of your health. So got to get on that scale. Also, it's important to get that blood pressure checked, get your cholesterol checked. So starting at age 18, get your blood pressure checked regularly. If you're over the age of 40, or if you are at higher risk for high blood pressure, get your blood pressure checked once a year. It's important to get your cholesterol checked at least every 4 to 6 years, early on. Some people will need to get it checked more or less often. It depends on your health status. So if your cholesterol is high, talk with your doctor about steps you can take to lower it. But honestly, so many people need to get their cholesterol checked at the very least once a year now. Just the way the standard American diet is pushing a lot of people into early diabetes and high blood pressure and all those other chronic diseases that, hopefully one day we can get rid of all of these chronic diseases. But diabetes is definitely on the top, one of the top chronic diseases on that list, um, that lead to um, death, morbidity, mortality. Mortality is the same as death, but I just really want you to take control of your health. And if you have diabetes, it's never too late um, to start taking control of your health. So I know you all probably tuned in to hear an integrative therapy tip or two. I can share 2 tips. Um, One tip, we'll talk about omega-3 fatty acids. I know you hear a lot about that now out there in the ether. But, omega-3 fatty acids are very important to our diet, and it's lacking in the standard American diet, or we call it the SAD diet. Fish and other marine species, as well as even some plant based foods like walnuts, flax seeds, and other grains, are great sources of omega 3. So, although they do not affect glycemic control or your glucose control, these fats have anti inflammatory, antithrombotic, and antiarrhythmic effects that appear to prevent and treat cardiovascular disease. And for this reason, they offer important benefits to patients with type 2 because patients with type 2 diabetes often have a really high risk of having cardiovascular disease. Vitamin D is another integrative therapy tip that I can share with you. Um, I want you to make sure you take vitamin D if you are deficient in vitamin D. Vitamin D deficiency is associated with a growing list of serious chronic diseases, including cardiovascular disorders, neurologic diseases, allergic and autoimmune problems, and several cancers. And from what we already know, vitamin D deficiency increases mortality risk in type 2 diabetes. There was one small study that reported that improvements in vitamin D levels were associated with reductions in hemoglobin A1C, which is a marker of your blood sugar levels. So this is one of the tests that you'll get for when you ask to be tested for diabetes. So we do often test the hemoglobin A1C. You may get a fasting glucose test. Just make sure you talk to your doctor about, what you need. Um, so vitamin D has been shown to reduce hemoglobin A1C in patients with type 1 diabetes. But, um, you should also, take your vitamin D if you have type 2 as well, because another study reported that large single doses given to patients with type 2 diabetes significantly reduced blood pressure. And another trial reported improvements in the inner lining of the heart and blood vessels. So, vitamin D trials, they've also reported improvements in chronic pain, in blood pressure, pregnancy outcomes, and autoimmune disease risk. The guidelines for vitamin D supplementation can vary widely. So, just make sure you talk to your doctor about getting your levels checked and talk about getting the correct dose for your condition, because everybody may not need to take the same dose of vitamin D. So, that's all I have for you today. I am Dr. Nicole Martin, your double board certified family medicine and preventive medicine physician. I help busy professionals use preventive and integrative therapies to not only improve the symptoms of many illnesses, but to cure some illnesses and to truly save lives. Through my books, seminars, and programs, you will get healthy and stay healthy. So thanks for tuning in, and we'll talk soon.